I'm Mark Jacobstein, general partner at South Park Commons. I am very excited today to be with my friends Tin and Raj, who are the co-founders of Axion. We're going to talk today a lot about what's happening with BCIs and what they're building. But actually, let me start here. Raj, you've put together a company you sometimes call the Non-Invasive Neuralink. Can you unpack that for our listeners? What does that mean? What are you actually building at Axion?
Of course. First of all, thanks for having us, Mark. So yes, non-invasive Neuralink, or how I like to say it, Neuralink, but without drilling a hole in your skull. And it started off in my grad school work, right? We came across this very unique neural signal. It's called an anticipatory potential. And that signal tells us your intent, like when you want to click something or not click something. It's a signal produced in the brain, like before you intend to move, before you intend to act, or before you intend to click.
Well, so actually, let me interrupt you here because I'd love to actually, even before we get to the anticipatory signal and what you uncovered in your time at Boulder, let's start with actually the problem you're trying to solve. And what does that actually mean, the Neuralink without drilling a hole in your skull? It's very dramatic, and I love it. People will, I think, respond to that. But say more about what does that mean? What's the problem you're actually trying to solve?
There are 8 million people today in the US and Canada alone that cannot use their hands to control a computer. Like, all of them suffer from upper limb impairment, like problems like ALS, cerebral palsy, spinal cord injury. And the current state of assistive tech is just complete garbage. Like, about 94% of these people say that the current assistive tech fails them. Like, imagine typing an email by blowing into a straw. That's how bad it is for these folks.
So the problem you're trying to solve is to give back basically dignity and the ability to work to folks who are motor impaired.
That's exactly right.
So tell us a little bit more then about what does the actual solution look like, and then I want to hear about the deeper science that actually made it possible.
Yeah. So we have figured out this technique that makes it completely effortless for the user to be able to interact with a computer and, as you said, get back their lives, right? Get back their independence, get back their autonomy.
The way I think about this is what you guys are building is the ability to look and think to click. And we'll overlay what the device actually looks like, but it's essentially a sort of a comfortable halo that goes on somebody's head. And it works in conjunction with your software to allow somebody who can't use their hands to operate a computer. This is this is an old problem, right? We've been struggling with this for as long as there's been computers that people wanted to control and people with motor impairment. What has changed? So I think this gets us actually to some of the things that you discovered when you were in grad school.
Yeah. That's a very good point you bring up. And as I like to call it, the EEG graveyard.
Yeah.
People have tried this before, like dime a dozen. People have tried to make non-invasive BCI work. If it had worked, Neuralink would not be drilling holes in skulls right now. And what has changed right now is we know exactly which signal to look for in the brain. And by the way, this is my life's work.
Yeah.
Like, I had to go to grad school and figure out what kind of neural signal should even be used in the first place. Think about this problem from first principles. And that's when we came across this very unique neural signal. It's called an anticipatory potential. And that signal tells us your intent. Like, when you look at something, it tells us whether you want to click it, what you want to act on it. It tells us it's produced in your brain before you intend to move, or before you intend to click, or before you intend to tap, right?
And so this is sort of historically, this has been a very hard sort of signal from noise problem. You put a bunch of EEGs around your skull, and it's hard to ascertain, if not historically been impossible to ascertain, what is somebody thinking? You've got hundreds of billions of neurons, if not more. They're all firing. You've got a skull in the way, trying to figure out what's actually happening. So this is something that you went and discovered, and I think wrapped some IP around before actually starting the business. But I want to go back farther because it's clearly something you've been obsessed with for a very long time. Why? Like, I know a little bit of your history, like IIS before coming to the States, et cetera, but maybe let's walk it back a little bit. Tell me a touch about the founder journey, sort of how you got here and how that relates to kind of the work that you're doing.
Just to tell you a bit about my background here, I've spent more than 8 years in human-computer interaction. I grew up reading and watching science fiction, and I always thought, like, BCIs are going to be the inevitable endpoint. in the evolution of human-computer interaction.
Was there a particular episode of, I don't know, Star Trek? What was the? Do you have a moment from your childhood you can remember, like, this is what I'm going to work on?
Not particularly for BCIs, but I thought about it for augmented reality.
Okay.
So yeah, let me unpack this
please.
a little bit. So I think I was in undergrad or something. I hated computer science. And
that's why we have Tin.
Yeah, I hated computer science, and I came across this really cool demo. And there's a demo of a person wearing an AR headset. He looks at his hand, and it's like a virtual sort of wearable that pops up. And I thought that was really cool. It wasn't even like a physical wearable. It was like a virtual thing that pops up and provided all the information the person needed. And I got into augmented and virtual reality. And then I realized that AR glasses are one day going to take over smartphones. It's not a matter of when. It's not a matter of if. It's a matter of when, right? And the best way to interact with AR glasses are going to be brain-computer interfaces, because the AR glasses already sit on your head, and you don't want to use your hands to be poking around in the air, right? So if you just look at it, if you can just think about doing that action, and it happens in the screen floating in front of you. I thought that was really cool.
Yeah, I mean, there's something incredibly powerful about the notion of, like, I want to turn my thoughts and my intentions into electrons, and ultimately into something consequential, whether it's writing or something showing up on a screen. But obviously, what you guys have realized is that is most consequential for somebody who has no alternative and cannot type, et cetera. And I think that's a really important part of where Axion has landed.
Yeah, and if you think about it in the sense of the evolution of human-computer interaction, right? Like, first we had the command line, like you were typing memorized instructions on a computer, and then we had the Macintosh, although taken from Xerox PARC, popularized the point-and-click technique, right? They were the first ones to come out with the mouse. And then the iPhone 4S came out with Siri, and then we had voice interfaces. You just like speak the iPhone, and the iPhone would act upon your voice instruction. And then the Vision Pro.
It's hard to remember when Siri was actually cutting edge.
It was a long time
No
ago.
theories.
Yeah. And the Vision Pro came out and completely removed the controller entirely. And all of these steps have had like two patterns in common. Can you guess what those patterns could be?
One is probably that they work well with something that humans already do well neurologically. This is why, like, a mouse works better than a trackpad for most people. Like, we have huge parts of our brain that are really already structured for us, like, to follow things with our hand. We can all catch a ball, even though, or many of us anyways, can hopefully catch a ball, even though we couldn't sort of describe the physics of a parabolic arc, for example. And I think that working within the constraints of what human brains already do well is probably, hopefully, I don't know if that was one of the two that you were thinking of.
No, not quite.
Right.
But I'll add a third, yeah. So what the two patterns that have been in common are, one is the friction reduced, the amount of effort you're putting in, while at the same time, the amount of information you're communicating, the throughput, increased, right? And if you follow that line all the way to the end, the inevitable endpoint is going to be a brain-computer interface, because from first principles, your intent first originated in your neurons. And if you can capture that in a way that a computer can understand it, if you can capture your intent and communicate that to your computer, you enable the highest possible throughput and the least effort form of interaction that was ever possible.
So ultimately, one way of thinking about measuring your success is sort of bits per second. That people are essentially, can I translate my thoughts into bits as quickly and as effortlessly as possible.
And also, I like to think of it like this: your hands evolved to pick fruit, not interact with computers.
Interesting. Fair. So shifting gears here a little bit, Tin, your career very different. Obviously, I suspect you did like computer science, unlike Raj, and obviously spent a lot of years as an ML researcher, developing new drugs in Vienna before you guys ended up together. Trace, tell us a little bit about the career arc, and then also I want to hear how you two ended up working on this project together.
Yeah. So my background is actually in mathematics. So I started first studying mathematics, but then I was so interested, I thought the ML is going to be the next big thing. And that was actually 10 years ago, when it wasn't that popular. You couldn't even study it. And then I started basically learning it myself. So since 2016, I started with ML from basically before even the big paper that kind of enabled many of those things, which is attention is all you need, right? At that point, that wasn't even known in anything that we're going to use the transformers or anything else. So I kind of just, out of my own curiosity and out of thinking, okay, this can be massive, I started doing that like in my free time, and then later on also did a master's in the machine learning. First, I worked across some, let's say, banking or insurance industry, which really wasn't my cup of tea. And then I ended up working on the drug discovery, where I led the machine learning team. We made some good progress. I think actually still some of our papers are state of the art when it comes to the specific thing that we're doing, which is ternary complex prediction, targeting the previously undruggable targets, proteins, pathogenic proteins. Later on, I worked with Harvard's Spinal lab to generate novel DNA sequences because I was just interested kind of in this realm of connection between biology plus machine learning, because one of the thoughts that kind of led through my whole life is the Naval Ravikant's thought of, it's very hard to be good at one thing, but if you combine multiple things, it's much, much easier. And basically you reiterate until you become the best at what you do, right? And that was my thought. And then later on, I had a company in clinical trials where we ran one of the biggest clinical study for the non-small cell lung cancer with 45 hospitals in England. And
what was the therapeutic?
There were 3 of them, so it wasn't the drug specifically, but there were 3 that were targeting the non-small cell lung cancer, and then they kind of seen, okay, what are the effects and what are the side effects of each of those three of them. And then since 1.5 years ago, basically, Raj and I started working on decoding human intent with Axion, and that's where this all started with.
I love this as human intent detection. This is a great way to think about that. So how did you meet?
So we met through a mutual friend that recommended us basically working together because we needed both the machine learning and also
needed a mathematics person.
Yes, it needed somebody who didn't hate the computer science.
Yeah.
So let's shift over to the science side a little bit here. I feel like the core discovery that helped launch the business was this notion of the stimulus preceding negativity signal that you found while you were in grad school. And as you told us earlier, you literally went to grad school to try to discover the thing, and fortunately actually did, which is probably not often the case in grad school. Say a little bit more about this signal and what it opens up for you with what you're building at Axion.
I can touch a bit on like how everyone went in this direction.
Yeah,
right. First, I was doing a lot of work in eye tracking. I had the chance to publish like more than 15 papers in some of the leading venues like Chi and UBCOM. That's where Apple and Google published their papers. And before coming to the US, before starting grad school, I was at the Indian Institute of Science. That's like the Stanford of India. And it was there that I was working with my professor. He did his PhD in eye tracking at Cambridge. And so I was doing a lot of eye tracking work there. And one of the core issues with eye tracking is something called the Midas touch. The Midas touch is the name taken in academia after the King Midas story, where everything he touched turns into gold. Accidental selections, right? So
right, and it's not a good thing that these things turn into gold, right?
Right. He hugs his daughter, and she also turns into
unlike
gold.
The Midas list for investors, which
no, that's different, yeah. And so I wanted to see like how we could solve that problem. Like, how do we know when a person looks at this target that they want to select it, when a person looks at this target, they're just observing it without that intention to select? Like, right, as a person, if you're using the system, you know that you want to select this, or you don't want to select this. So there has to be some signal in the brain that tells us that. And so that was the whole research study was designed around that. And then we ended up coming at this signal in the occipital lobe of the brain, which is the visual cortex. And how it works is, or what is the biological significance of that signal? It's an anticipatory potential. That means it's anticipating something. So if you look at, let's say you pull out your phone, you want to dial a number, you open the keypad, you look at the number 2. If you want to select it, you expect some sort of visual feedback from that letter, from that key, right? Your brain knows that. And it knows there's a future stimulus going to happen. That's the selection feedback. And it knows that future stimulus is going to happen. So what your brain says to all the neurons is, hey, quiet down. We need to make room to process that future stimulus. And that quieting down is a downward dip in the EEG signal. And that acts as a switch. If you looked at that number 2 button without the intention to select it, we wouldn't see that dip in the signal because your brain is not preparing itself because it knows there's no feedback.
So fascinating, and in all our time together, I've never had you actually explain that to me before. So very cool. I'm curious whether you found the signal and realized its value, or you went looking for the signal because you knew this was something that was important for you and were able to find it.
This signal has sort of been known since the 1960s. But no one has actually made it work for a human-computer interaction task. No one has used it as an intent wrapper, right? And so we had to go and address some of our confounds in the research. Like, is this signal really correlated with the person's intent, or is it correlated with the target giving the feedback? Like, how do we know that, right? Like, if the person did not intend to select it, but the target still gave the feedback, is that signal still present? That would be a false positive.
Well, and my assumption is also that you're still doing this through somebody's skull. You're doing it with EEGs. You're doing it with a human brain that has an awful lot of neurons that are firing in different ways. And so the signal noise issue is an issue. And actually, you're sort of, speaking of anticipating one of my next questions, which is sort of like, how good is this? And I know some of this now bleeds into like, why we need tin, because like, it's probably a little different in coming off the back of my skull than off of the back of your skull, et cetera. And so there's some training issues, et cetera. So talk me through a little bit about like what the state of the art is today in terms of, how good is the ability to tell whether or not I actually meant to say click? How good do you think it will be? And maybe, Tin, I'd love to hear your sort of thoughts on like the types of models that with the work that you've done in order to take what I guess the term of the art would be the AUC and get it better and better and better, the area under the curve, and make it so that it's extremely accurate. So sorry, long-winded question. Maybe we'll start with sort of how good is it today?
So one thing we quickly realized with just taking the SPN signal, because it does not require any conscious intent itself to tell the computer that you want to select something. So we realized that it can become very philosophical. Like, how does the computer know that I want to select it even if I don't know? So we had to sort of mix it with other anticipatory potentials and other signals in the brain. So we also measured the motor cortex, which is over here. There's an anticipatory signal there, which is a pre-movement intent. Like if you're thinking about moving your fingers, before you move your fingers, there's an anticipatory signal over there. And then we combine it with a few other features to get really high accuracies in intent decoding. And probably Tin can talk more about.
So as far as the intent decoding, though, it sounds like as a result, this sort of interplay between what's happening in the motor cortex back here, like, is probably slightly different from person to person. Is that true? And maybe it leads into like how you think about training this.
It's very fair to say, because it's not only that our brains are different, also our head geometries are different. Also, the type of hair that you have is going to affect the performance, right? Because we need to have a very good skin contact. So all of those things come into play. But the thing, and what we've seen, like with collecting kind of more data across different participants, is that once you start collecting across many people, that differences start to fade away, right? And what we've proven, like what kind of the biggest test for this topic is the unseen participant, right? So if you're able to kind of generalize across the unseen participants never trained before or never seen before in the data set, then you're going somewhere, because that also means that in the future you won't need to recalibrate. Now, to give a bit to go a bit back and give a bit info about the calibration, is that even the invasive systems like Neuralink, they have to calibrate, right? Before they used to calibrate every day. Now potentially it's not as often, but the goal is kind of to reach the BCI state where you can just put the headset on and just go. It just works. So what we've done is that we collected across more than 80 people, multiple hour sessions with our experience with data collection techniques, in order to find out if this is going to translate across the unseen participants. And what we've seen is, and what we discovered is a very good log linear scaling law, which tells us, okay, the more we go and the more data we collect, we can reach very good generalizability and very good performance for the unseen participant. Currently, we have, I can even talk about accuracy because in the online case, we measure accuracy, and I think it's much easier for other people to understand. We get sometimes more than 90% accuracy. This is still dependent on the participant. So it's, for example, for me, it's around 85, 86. For one of our employees is for 91% online accuracy. But what we see is that it's not only the data or the training that keeps getting better. It's also the person keeps getting better. Mm-hmm. So, for example, when I first started collecting data for myself, my performance wasn't as good as it is now. So kind of combination of the machine learning together with the data collection techniques and also emitting this signal in the brain is the winning scheme.
That intuitively makes sense. I mean, with all the other things that we learn to do in our life, right? We try them, we get it sort of right and sort of wrong each time we observe the results and we think of it as training our muscles perhaps, but actually what we're doing is training our neural circuits to hit a forehand or to write on a piece of paper or whatever else. But it sounds like over time, what you're doing is you're training your brain is the SPN, like the look and think to click gets better and better and better over time. And for somebody who struggles with motor impairment, this is going to be something they do many hours a day, if not all day long. And so presumably will ultimately get extremely accurate. Let me back up a little bit, because one of the things that I think is coolest about Axion is this is not theoretical. This is not a science project, right? This is actually happening. And you guys have an extraordinary video that you sent me about 2 weeks ago. And I embarrassing confession, you literally made me cry. So, and you made me cry, and then so the video shows
that was the goal.
Well, you succeeded. So the video shows an Axion user who lives in the Bay Area, who is paralyzed and has struggled with sort of living their daily life and interacting with computers, et cetera, since their accident, using your product. And it's incredibly moving to see his life and how it's been changed, and his mother's in the video and all the rest of it. I took it after I watched it for the first time, and I brought it out to sort of show my wife and show my kids, and my mother was in town, and like, this is why I do what I do. So first of all, thank you guys. It's incredibly important, but also as a business, I mean, it's like you guys are getting ready to move this thing forward. So where are you guys in terms of like, right now it's moved past science project phase. Like, what's happening with the business as far as ability to bring this to the market?
So we're direct to consumer. And by the way, I told you before, like there's like 8 million people that need this device. Like they needed this yesterday. And they write to us every day. Like we have in our office, like clippings of all the things that are written to us. And each one of the stories is a very heartfelt story. We use that as motivation. And
there's thousands of people on the wait list already.
We have 5,000 people on the wait list already, which is kind of wild for a product you cannot even purchase yet. And we're working with the best leading rehabilitation hospitals across the country, like 5 of the leading rehabilitation hospitals, including Mass General Hospital, which is one of they're ranked second in rehabilitation. And we're working directly with the BCI clinic there, with Dr. Daniel Rubin, who's the head of the BCI clinic.
Fantastic. So let maybe go back to the technology a little bit here. I don't want to lose this thread. When you went to grad school, one of the things you were working on was eye tracking. So it's funny because even some of the partners here, when we talk about what you guys have accomplished, I think the piece that people understand that is exceptional is this notion of anticipatory click. Like, oh, wow, nobody's ever been able to think and click. Eye tracking seemed like, oh, it's a solved problem, relatively commoditized. There's lots of eye trackers you can buy out there, until you actually start to think about the nuances of that. And I think most of us aren't conscious of it, but like the way our eyes move is actually very complex. We have saccades and microsaccades. Our eyes are sort of dancing all the time. And so what I'm actually looking at is a much more complex problem, I think, than people realize. And also generally requires lots of calibration, et cetera. So say more maybe about some of the work that you've done on that side as well.
Yeah. So first, I would say that like when we began working on this is that we both have a notion of Like nobody cares. Like nobody's gonna buy and use this if this is sexy or because this is BCI. Like no, this has to be the greatest product once they put it on their head and actually use it, right? And that involved then two kind of problems. And as you mentioned, right, one of them is the neural, one of them is the EEG, and the second one is the eye tracking. Eye tracking, as you also already mentioned, is thought as being solved. But if you try many of the eye tracking solutions, they work really bad, are really fatiguing, and are really imprecise. So coming into that and trying to improve that was actually not an easy thing to do. So combining that together with the EEG and also combining the modalities, right? Because we do combine eye modalities and EEG modality in order to have the best performance. That was a hard thing to do. Now we can confidently say that we have a very good eye tracking that works across participants, that provides a very smooth experience, and that for me works then better than any other eye trackers that you can buy. That some costs even up to 20K.
And presumably all of this, like all things ML related, like all of this is going to get better over time. More data, both with individuals and then across a broader cohort of folks. I assume the eye tracking gets better, the ability to anticipate gets better. I assume even things like ability to work with things like autocomplete. Because it's one thing, I imagine the first utility of this is I have an iPad and I want to find an application to open, and I can look at the application, I can open the application, I can move a cursor around, but ultimately I want to be selecting letters and writing words and actually communicating that way. And I assume that that's also going to get better. I don't know if you guys are innovating on the autocomplete side of things as well, like how you think about that.
I get the. I mean, one of the very important things when it comes to the whole improvement and performance is the UI UX also, right? So it's not only about that we have 95% accuracy, right? It all sounds nice in a vacuum, but if you're not providing a very good experience, like nobody's going to use it, right? Nobody cares. So we as humans are very subjective. So we need to provide very good feeling of using the device, that it's not fatiguing. Just because somebody is motor impaired doesn't mean that they shouldn't be able to use the computer the same way that we use the computers, right? Or even better, right? Why not better? So I don't think there's any limitation that we should think about. I think we can just get better.
Yeah, I was gonna say, one of the interesting things you guys told me a couple months ago was how much time you were spending on making the device comfortable. Which is one of these things like sort of easy to overlook. Again, like, well, somebody who's motor impaired, this is life-changing for them and they'll sort of use it no matter what. Well, that's not really true. Like people, like the idea is you're going to have this on your head for the entire day. And I know you'd spend a lot of time figuring out the fabrics and the flexibility and how to make this work. Talk about the sort of user design issues on the hardware side of this, Raj.
So the endurance is the whole point here. Right, not providing them a fatiguing experience which they can wear for like 30 minutes and then they have to take it off. That was one of the main reasons why the Apple Vision Pro flopped. It's like this big piece of metal you're wearing and you have like all this neck fatigue and strain, and you have to just remove it and throw it across the room after like 30 minutes of using it. And that's one of the biggest things that we are designing for. Like, how can we provide an experience for the user that they can wear it for almost 8 hours a time? Because that's how long they're going to be using this every day. They're going to be using this to communicate with their loved ones, communicate their basic needs, right? Like if they have an itch or if they need to go to the restroom, probably even get back to remote work and provide for their family instead of being a burden for their family. And so we really need to we need to solve all of those issues that they currently have that allows the hardware to be worn for more than 8 hours. Like, most of these users, they're in a supine position. So if you're providing them an EEG headband with electrodes in it, you need to make sure there's no pressure points on those electrodes because they're always resting their head on a wheelchair or on a pillow, right? And so you need to solve for that. You need to solve, it cannot be made of a hard shell. It cannot be made of plastics because then again, that throws the signal off. And one of the biggest trade-offs in mechanical design of hardware is how do you get good signal to noise ratio in the signal and versus how do you provide them all day comfort? Because those two things are at odds with each other.
It's super interesting. What another question for you guys. within the SBC community, we have a number of companies that are working on accessibility. You guys are sort of a leading company in that space, obviously, for folks with motor impairment. And one of the things we think about with anything that's being built with sort of accessibility in mind is what people call the curb cut phenomenon, where they cut curbs to help folks in wheelchairs, and it turns out it was really helpful for somebody who's got a stroller, or somebody who's older and has got a cane, or just for children. And it turns out almost everybody likes a cut curb. I think about that a lot for what you guys are building too, and I know you're sort of building for the future. So if you look out 2, 3, 5 years from now, and you think about like what Axion's impact on the world might look like, and what the maximalist version of what you've created could be. Do you want to talk a little bit about that vision, Raj?
I think
your whole life has been building up to this point.
Yeah. When I started this company, my sort of the thought I had in my head is like, when will I be happy about the success of this company? And that's going to be when I walk out the door and people are wearing Axion headsets on their head, and they're interacting and going about their daily lives. They're more present in the moment, right? They're not like looking down at their phones, right? It's the technology like sort of vanishes into the background. And that was sort of the goal with this. And where we see this going, like first, yes, we want to help a lot of millions of people with upper limb impairments. That's our immediate focus. But I think soon we don't even think of ourselves as an assistive technology company, because we're providing the ability to use a computer much better than what an able-bodied user is doing today. So we're more of superhuman tech rather than assistive tech. And we'll soon be going to be crossing the chasm to the consumer landscape. We're going to be starting with gamers who want that super fast reaction speeds. Like there's 300 million gamers out there for whom doing a much faster click than, moving a mouse cursor all the way to somewhere and then clicking it, that's going to be like much better to use, just look and click like in an instant, right? And then like knowledge workers who are getting things done on a spreadsheet. Like think about how you use a mouse today. Like if you want to click on something, you first look at the target, and then you have to move the cursor all the way to the target and then click on it, right? We completely eliminate that pointing step because we're using your eyes itself as the pointer. And so you're able to breeze through tasks much, much quicker. And that's the future we're going for.
Well, and I think this notion of decoding thought in general is extraordinarily powerful. I mean, to your point about being more present, it is very distressing when you sit on a train or like a subway or train, like, and everybody's staring down at their phone, but they're doing it for a reason, right? They're trying to get work done, or they're trying to absorb information. And I think a lot of that can be done in a way that is more present if I have the ability essentially to transmit my thoughts into electrons without actually having to two thumb. It is amazing. Like today, still so much of this happens with like 2 thumbs, which is we're adaptive, and it's cool that we can do that, but it doesn't seem like the end state for sure. One of the things I am curious about is that you mentioned earlier, like the graveyard of BCI companies. Like this is something people wanted to build, which you guys have built for 10 or 15 years. I have to admit, like even when I decided like SBC, like I want to invest in you and SBC wants to invest in you, it took a little leap of faith on my part too, because I've been looking at BCI in probably 15 years since I first saw like the emotive headset that people were working on. And it didn't work, and it didn't work, and it didn't work. And one of the interesting things, even as an investor, is I see like these things like you believe in the thesis, it's the wrong time, it's the wrong time, it's the right time. What would you say to other people who want to work on like deep tech, hard tech problems that they're hard, right? About sort of courage of your convictions. Like what helped you get over that hump? What gave you the courage to go and actually start this thing and give up whatever high-paying jobs you could have had, careers you could have had, and go build a startup, which, as we all know, is really hard?
I would say first that don't follow trends. If you have a certain vision in mind, just work towards that problem. It might not happen like 2 years from now or like 3 years from now, but eventually it would happen. So you need to have absolute, if you really have that conviction, absolutely go for it. And that's the level of conviction I had for a brain-computer interface. Like I knew that the whole world will move towards that, and it's happening right now. Like it was not happening for the past few years, and now non-invasive BCI space is like heating up, right? So yes, absolutely believe in that conviction. See where the world is going. It's like that saying, like, don't go where the puck is, go where the puck is going.
Yeah, skate to where the puck is going to be. It certainly worked for Wayne Gretzky. Thanks, guys. This was great.
Thank you very much.
Thank you, Mark.